Okay, record. Hello.
Hi.
How are you, Mr. Lin and Mrs. Lin?
Fine, we are fine.
How are you doing tonight?
Good. Good.
So today we are going to talk about BPH. Are
Okay.
you familiar with BPH?
Now, what is BPH?
BPH is hyperplastic or benign prostate hyperplasia. It is overgrowth of cell around the prostate gland, and it's very common for the men greater than 60 years old.
So what is like prostate?
Oh, prostate is a male organ reproductive system. It's an organ that produces the milky fluid, and it is to nourish the sperm. Mm-hmm. It helps produce, helps us preserve the sperm.
Well, is BPH, you just say that BPH is overproduction of cell, so does that sound like a tumor?
Oh no, it's actually different from tumor. Generally, with the benign prostate hyperplasia, it is overgrowth cell. So the cell are like our normal cell, but just producing a lot of normal cell. So it actually is called benign. It does not harm the person. However, a cancer, prostate cancer, it is more malignant cell, and it will be required testing by the PSA and and even biopsy to test it.
Oh, interesting. So it sounds like BPH is benign cell growth, mm-hmm. and it grows a lot. Mm-hmm. When does it start to grow?
Oh, good question. Generally, from prostate, it grows throughout a male's life. It was male hormone testosterone help grow the prostate. So generally, what happens is prostate by the prostate has two growth stages. First stage is puberty, and by the male become 25, they start growing in proportion of width and with a length throughout the age of 60. And by people who are greater than 70, 60, 70, so the study shows that prostate actually grow not just proportionally from width and height, it actually grow existing length is greater, higher than when you become 60 years old. So they are exceeding growth after 60 years old. So it's very common BPH for elderly.
So you mean if you get old past 60, for every male, they will definitely have BPH?
Yes, very common.
How BPH got, diagnosis?
Oh, good question. Diagnosis require patients classic symptoms such as frequent urination and urgency and dribble after urination. And we also have a test called PISS. It's a self-questionnaire to help provider to determine if you have a severe or moderate prostate problem. And if you want to do the test, generally the doctor, the urologist doctor will do the flowmetry test, and it will be in the funnel shape of the machine with the electrical wire, and they will measure the strength of the urine. And we also do the bladder, post-bladder residual test. It's a very simple test. After you urinate, the doctor just uses an ultrasound to check how much urine left in the bladder. And that's determined if you have a bladder retention.
Okay. So bladder retention, does that mean that he would want to go to bathroom but could not go to bathroom, or what? He would like wants to go to the bathroom but there he cannot pee?
That's true. It takes long time to start to urinate. He want to pee because he still has a sensation.
Okay.
And the problem with the prostate is that it overgrown the cell. It compress the urethra, so it make the urethra, or we call it obstruction. So it's harder to urinate. You will urinate, but sometimes it causes discomfort, and you want to urinate, but you could not completely empty it. So dribble after the urination will happen, and it causes male. It's sometimes very inconvenient for male, and sometimes it causes embarrassment. Sometimes it causes the pressure from looking for the bathroom.
So the recommendation would be like, if for somebody who has BPH, is to just go to the bathroom whenever he can. He doesn't need to wait until he has like the sensation needs to go to the bathroom, right?
You mean like training the kids?
No, I mean they just any chance they can see the bathroom and doesn't wait to the sensation, they just go to the bathroom. Would that help with
You mean frequent urination?
Right, even when you don't feel like you need to urinate. Would that help?
I'm sure it helps. But what if you don't have the urgency that time? Then you're not going to want to urinate.
Oh, okay.
So it's a common problem.
So what's the treatment for it?
Yeah. So.
We have the oral medicine and the surgical procedure. With a mild symptom, it will be used the alpha blocker is to smooth the bladder, and the other one is called 5-alpha reductase inhibitor. It's help to prevent the hormone changes. And the study shows with these two combination drugs, it works very well. However, if you could not finish, if it still doesn't show any improvement, it still has severe bladder retention and sometimes UTI. UTI, urinary tract infection, it causes because the bladder retention, and it will help bacteria to overgrown, and so UTI is one of the symptoms. To treat it, sometimes surgical is very helpful, like a very common called TURP. It will help the doctor will use a small a catheter and try to use the heat, try to get rid of the bladder excess bladder muscle. Get rid, and it will help you smooth. You will help to urinate. However, you probably need to wear the 40 catheter for a couple months before your wound heals.
Whoa, that sounds painful. Well, besides those two treatments, do you have any recommendation about like diet or something like that?
Very good question. We do have a life modification, behavior changes. So we will encourage, don't drink alcohol, don't drink coffee, and sometimes yoga, exercise, and meditation will help you to relax your mind so you don't feel like you need to urinate so frequently. And tomato has a very good substance called lycopene, and it's very helpful. It's prevent or protect your blood, protect your gland by to prevent cancer.
So raw tomato or fried tomato?
Oh, they are all good.
They are all good.
Yes.
Mm-hmm. Well, I'll plant many more tomato for you.
Okay. Very good.
All right. Well,
Do you have more questions?
now this is very clear now. Thank you so much.
You're welcome.
Thank you.
Yeah, thank you.
Thank you for allowing me to teaching you both tonight.
Thank
Thank
you
you very
for
much.
letting us know about.
Thanks.